to address two of those directions. So go ahead and reference my other videos to get a full foot and ankle mobility program. But for now, I'll tell you about the many directions of the ankle. First of all, we have dorsiflexion and plantar flexion. So dorsiflexion, toes to knee, plantar flexion, pointing your foot like a dancer, right? The foot also moves into inversion and eversion. We have inversion, eversion, and it rotates into supination and pronation. Supination, pronation, right? So the foot is very, very complex. This video is only going to address the ankle joint. We call that the talocrural joint, into dorsiflexion and plantar flexion. Now, dorsiflexion and plantar flexion is a cardinal motion of the ankle joint, and we use it so much when we walk. Just think about it, right? When we walk, you have to dorsiflex to strike your heel, and then you slowly load through your foot. You'll need more dorsiflexion as you step forwards, and then your ankle moves into plantar flexion as you push off and get ready for the next step. So it's very important that you have mobility through those two motions of the ankle. So first exercise that I'll take you through, you'll need a small foam roller, maybe a water bottle, just something that you can place your foot on and roll back and forth, okay? You'll place the sole of your foot onto your small foam roller or a large water bottle, and then you'll slowly roll it back, try to drop your heel all the way down to the ground. You'll then roll your foot forwards, point, and try to touch the very tip of your big toe all the way to the floor. Nice and slow, back and forth. If you don't quite get your heel to the ground, don't worry about it. This is practice, not perfect. If you don't quite get your toe to the ground, don't worry about it. Just do your best and notice how your foot is moving slowly through dorsiflexion and into plantar flexion. All right, nicely done. Next exercise that we'll be doing is all about dorsiflexion. You'll need a wall for this exercise, so I'm just gonna walk over here to my wall. You've probably done something like this before in your life. It is a calf stretch, but it also does move you into dorsiflexion. Okay, you'll step one foot forwards and the other foot backwards. The more you bend your front knee, the more you're going to feel a stretch through your back calf, and the more your foot is going, or rather your ankle is going to be moving into dorsiflexion. You'll hold here for about 15-20 seconds, and then try bending your back knee. Notice how the stretch moves down towards your heel, and your ankle moves into an even deeper dorsiflex position. Now with this stretch, your heel should be on the ground. If you find that you're up here, shorten your stance a little bit until you're at a place where your heel is all the way on the ground. This should be relatively intense through your ankle joint. Now when the knee is straight, we're stretching a larger muscle of the calf called the gastrocnemius. When the knee is bent, we're actually bringing the stretch into a smaller muscle of the calf called the soleus. You have another very important calf muscle called your posterior tibialis. To stretch that muscle, you'll need a small rolled up washcloth. Make sure it's got a nice roll in it. And you'll place the outside of your foot, so that's the pinky toe side of your foot, onto that towel. You'll then slide your foot back, and same idea as the stretches we just did for the gastrocnemius and the soleus. You'll bend your front knee and draw your hips forwards until you feel a nice big stretch through the inside of your calf. Now you should be feeling this more through the inside of your calf. The posterior tibialis is a more medial, that's inside calf muscle. The posterior tibialis attaches to several of the little bones in your foot. If it gets tight, if it gets inflamed or irritated, it can really cause issues, pain, dysfunction through your foot and ankle complex. So again, very, very important to incorporate this into your dorsiflexion stretching. Okay, after you've held that one for about 15 to 20 seconds, you can slowly come off. We've already stretched into dorsiflexion. We are now going to move into plantar flexion. So for this, I recommend grabbing a bigger towel for your knees. You'll place the towel down on the ground, and knees will be right onto the towel. From here, you'll untuck your toes, so feet should be pretty flat on the ground. You're in a plantar flex position already. If this is already intense, you can stay right here. You don't need to drop your hips back anymore. But for a deeper plantar flexion stretch, you'll slowly begin to drop your hips down, down, down towards your heels. When you feel a stretch, that's where you're gonna hang out. This should not be painful, but it should feel like a stretch, okay? So make sure you drop your hips down far enough so you're getting a nice deep stretch through the front of your ankle complex, moving into that plantar flexed position. Okay, I'm gonna show you guys one last exercise for plantar flexion and dorsiflexion. From here, you can actually get rid of your towel and you'll lie all the way down onto your stomach. Okay, so take a note of my knee and my ankle here. What I want you to do is bend your knee at the same time, flex your foot, dorsiflexion, then point your foot, plantar flexion, and straighten your knee. Squeeze your quad to get it all the way straight. Bend the knee, dorsiflex the foot, point the foot, plantar flexion, and straighten the knee. Move through this, coupling knee flexion with dorsiflexion, coupling knee extension with plantar flexion. These are reciprocal movements, so when you bend your knee and activate the musculature behind your knee, this gives the musculature on the front of your ankle that causes dorsiflexion maximum power. The opposite is true when you point your foot and straighten your knee. You're activating the musculature on the front of your leg, giving your calf, the muscle on the back of your leg that we just stretched out, maximum power. So keep moving through this. It should feel really good to move your ankle and your knee in this way. It's preparing you for functional motion like walking, running, jumping, hiking, all the things that you want to get back to. With my patients, I like to see a minimum of 10 degrees of dorsiflexion. That's for proper gait mechanics, reducing the risk of tripping and falling, and reducing the risk of issues up and down the chain, right? If we don't have enough dorsiflexion, sometimes our knees can move into funky positions to compensate for that lack of dorsiflexion. It can also lead to issues in the foot, down the chain. So very, very important that we get at least that 10 degrees of dorsiflexion, sometimes more depending on the sport that you're into. Snowboarders, for example, typically need quite a bit more than 10 degrees of dorsiflexion. So make sure that you're talking with your physical therapist and meeting the range of motion goals for your ankle that are appropriate for what you're trying to do. All right, guys, thank you very much for watching. I appreciate your time. Stretch out those calves. They're very important.